Hello, our viewers. Hello. Hi, Aben. Hi, Miss Cindy.
Hello.
Hi.
Today, we have two very expert and experienced profession. One from Aben, from clinical coach from BENPHYSIO, and also Miss Cindy Chua, our special guest today. A very experienced dietitian, now working for
Yes,
Groway.
another language.
Yeah, beautiful lady. So both of Mr. Ben and also Cindy Chua also been very experienced in public health. Been doing a lot of public health education and training as well, right? So
Yes.
Sharing.
Yeah. So today we're gonna share about the knee pain, a final topic regarding our knee. Okay, so today we're going to talk more about our joint, about the joint space, right?
Yes.
And and those viewers, if you are here already, just give us some love, give us some support, just +1 if you are here watching us, and tag your friends and family already. Okay, so because today Groway is going to give out 6 mystery gift. 6, not 1, no, it's 6 mystery gift worth 40 ringgit each. So take this chance to stay tuned to the end. We have a big surprises for you, quizzes for all of you. Yes, Aben.
Yes. So who should we tag? Who should we tag? Tag your friends who are in the middle 40 and above, already known with knee pain, or they may have a little bit of knee pain. Okay, so tag them, or they already planned for operation. All right, do tag them. So we are not here to convince people that don't go for operation, don't go for injection. We are not. Okay, we are just here that just to explain to you how do we see knee pain from our perspective. That's all. Okay, just to open up your mind, just to let you know, expose a little bit more, different perspective. Okay.
Yeah. And before we start, just some disclaimer alert first. Okay. So this presentation or any content is just for educational and education and informational purpose only. Okay, just for us to share, and we also not responsible for any damages, for the any information presented. Yeah, and this content is not intended to substitute any professional medical advice. So if you have some health condition or kindly seek for a qualified health provider and also physiotherapist or that profession dietitian as well. Okay. So of course everyone age, but what we want to, in our end of life, we want a healthy aging, meaning that we wanted to optimize or maintain our functional ability. Right, Mr. Ben?
Sorry, that's why we are here today. We are here to share with you how to age healthily and mobile. We always listen to our clients, and they always tell us, during young time, no money. Okay, can walk, but no money, so don't travel. But during old time, cannot walk, got money already, but cannot walk. All right, so also cannot travel. So at the end, they cannot spend time on the traveling. All right, so at the end, what we want to do here is just some simple sharing. All right, so at least you still can move around, move about with your spouse, with the most important people, and then just walk around. Okay, travel around. Yeah.
Yeah. And today we are heading to the degeneration. Really, is the degeneration series is 1, 2, 3, 4, fifth life for degeneration series,
life.
Right?
Yes.
Yeah.
Yes.
It's talking about joint space.
Yes. Joint space.
Yes. So just ask about the viewers, what do you know about joint space? So we want to let Mr. Ben to share about what is really the joint space, what is really the problem,
Okay.
And
okay, thank you. So again, before I share about joint space, right? Okay, so go back to our common myth about knee pain. Does exercise matters? Oh, so some people say I exercise regularly, yet I have knee pain. Okay, some they say I don't even do much exercise. Why I still suffer knee pain? Okay, so the answer very simple. It's not about the exercise that matters. Okay, it's about your stiffness of your joint, stiffness of the muscles around the joint that matters. Okay, now the myth number 2.
Okay. Does body weight matter?
Yeah, does the body weight matters? Okay, some people say, oh, I'm overweight, that's why I got knee pain. Makes sense. Okay, but say some people, I'm thin frame, yet I got knee pain. Why? Same thing again, muscles. Okay, muscle stiffness, all right, that leads to wrong biomechanic around your knee. All right, and common myth number 3.
Does age matter?
All right, does age matters? As usual, I'm old, I got knee pain. Makes sense. All right, this is what everyone telling us. All right, but some people in his 30s, 20s, yet they have knee pain. So what does matters? Not age, but it's again your muscle stiffness. Because muscle stiffness happens at any age. Okay, next. So common myth number 4.
So is total knee replacement an option?
Yep, so depends what kind of condition. All right, but of course, we hope that we can explain to you a little bit more, okay, before you go through it. Okay, so, I mean, there's no answer for this question, all right? But just that we are here to let you see from another perspective, okay, how does the joint space work today? Okay, and common myth number 5.
Does glucosamine work?
All right, so often our client says, hey, I do take some glucosamine supplements, okay, and it works for the initial months. After that, it's the same. So actually, research has says that glucosamine works for cartilage, work for regeneration of the cartilage. But question is, when it comes to this statement, right, why it does not work at the end? Because your muscle stiffness is still creating a lot of wear and tear. All right, so you still need to work out on your muscle stiffness so that your wear and tear stops happening in your knees. That's where whatever your glucosamine supplement you take in will work at the optimum level. All right, so answer yes, but it's just that your muscle wear and tear is still ongoing. That's all. So you need to stay tuned to learn how to get rid of those muscle stiffness.
Yeah, so thank you, Abel, for sharing. We just, Miss Cindy, do you mind to share about from your perspective?
Okay, so from my perspective, I'll be touching about the nutrition part in terms of managing your joint pain. So just want to share with you some research. Statistics shows that 10 to 20% of Malaysian adults actually have knee osteoarthritis. And 45% of Malaysian, especially our Malay friends, actually have knee pain, a percentage that is more than Chinese as well as Indians. Okay, in terms of gender, Malaysian women, as many as 44% actually are more prone to hand osteoarthritis. Okay, so hand, it could be because you're doing too much housework, like washing clothes or things like that, or ironing, okay, or maybe carrying a baby, etc. Okay, so when it comes to osteoarthritis, many will go for medications as prescribed by your doctors or pharmacists. So what could be the possible side effects of your medication? So let me share with you some of the common symptoms that you may experience. Okay, so first and foremost, some people may experience things like nausea. Okay, so and then some people, worst case is vomiting. Okay, in terms of your bowels, it may actually, some medications may be strong enough to affect your bowel movement. And then worse still, some people may experience headache or migraine. So these are some of the common side effects of the medication prescribed. Again, it depends on the dosage. Okay, all right. So next thing, I just wanted to share with you a simple phrase. Lifestyle diseases, including osteoarthritis, it is a threat to push your health or body backwards. Okay, so be careful and stay tuned to some of the practical tips from Ben and myself today, so that we can help you to be back on shape. Okay, so when it comes to disease, okay, so it actually reflects on how much you eat and what you eat. Okay, so meaning that every time you eat something, you are either feeding a disease or fighting it. Okay, so just want to share with you some of the common foods. For example, if you love eating your high fat, high sugar, high salt choices, all these are actually high in inflammation, high inflammatory foods. Okay, so this actually research shows that it may increase your risk of joint pain. Okay, so you can enjoy these foods, but try to enjoy it sometimes, okay? Because we don't want you to have joint pain unnecessarily. Okay, so moving on. So being Malaysians, some people may ask, what is a healthy plate? Okay, so can anyone guess what should you have on your meal plate? All right. So the Malaysian context of a healthy plate, it's in Malay, it's called suku separuh. Okay, meaning that a quarter of the plate should be with your carbohydrates, be it your rice, noodles, bread, pasta, potato. A quarter of the plate with your protein, for example, eggs, chicken, meat. Okay, and then tofu, etc. And then half of your plate should be with high fiber choices, for example, your fruits and your vegetables. So this is a healthy, what is in Malaysian context of a healthy plate. Okay, so when it comes to nutrients, since our in managing osteoarthritis, we need to make sure our body cells are adequately fed, okay, are well fed, so that it can do the job it needs to help you. Okay, so we need to prevent our disease by nourishing our body with the adequate amount of right nutrients. For example, carbohydrates, as I mentioned just now, bread, rice, pasta, noodles. The fats, for example, lipids and sterols, okay. Protein choices like the meat, fish, chicken, eggs. The minerals, okay, like for example, calcium, magnesium, etc. Vitamins like vitamin A, B, C. All right, and phytonutrients, which you can get from fruits and vegetables, as well as digestive enzyme, because we need to look after your digestion as well. Okay, so one trick question. In Malaysia, we are exposed to a lot of sunshine. Okay, so do you know that sunshine actually gives us a good source? It is a good source of vitamin D. So, what is the best time for us Malaysian to get enough sunshine vitamin? So, the answer is 10 a.m. to 3 p.m. And you need a minimum of 5 minutes all the way up to half an hour. Okay, so it's not 7 a.m., it's not 6 a.m., okay, or it's not later. Okay, but the thing is that sadly, a lot of us who are stuck in the office or stuck at home because we're afraid of being tan, especially females, okay, may not have adequate vitamin D. So again, tomorrow onwards, try to get some sunshine vitamin to protect your bones, to prevent yourself from getting osteoarthritis. Okay, moving on. So fish oil. Okay, so we all know fish oil like omega-3s are very good for you in terms of preventing your inflammation. Okay, so research shows that fish oil supplementation can help prevent and reduce the severity of osteoarthritis. Okay, so if you are vegetarian or if you don't like the fish oil type of supplementation, you can consider things like lecithin. Okay, lecithin, it comes from soybeans. Okay, and lecithin, it is a good alternative to help you prevent against inflammatory diseases. Now, when it comes to inflammatory diseases, means anything that can cause internal fire in your body. This includes arthritis. Okay, so therefore be careful with what you eat. Now, when it comes to weight management, lecithin can help emulsify your fat as well. Okay, so moving on, we have things like magnesium. So magnesium, it is a mineral that is important yet easily forgotten. Okay, so you can actually prevent and better manage your osteoarthritis with magnesium. Magnesium is proven to be a natural muscle relaxant. Okay, and then also it will help with your skin hydration as well. Okay, so next we have, when it comes to bone and joints, we cannot forget about calcium. Okay, so calcium.
Hello? It's like
Okay, it's okay. So let's move on to devil's claw then. Okay, so just what I wanted to say, so when it comes to magnesium, we can actually pair it with calcium because calcium is a good source of for bone mineral. Now, when it comes to pain relief, you can consider things like devil's claw. Okay, so devil's claw is proven to be a natural pain relief herb to help those with osteoarthritis. So what does devil's claw look like? So this is the devil's claw plant or the herb. Okay, so basically it helps control your internal fire, and then it is very good in reducing your pain. Okay, next is we want to ensure that our body cells is well nourished with all the vitamins and minerals. So let's not forget to take a good multivitamin every day. So what is a good multivitamin? That includes things like vitamin, minerals, okay? And then it will be good to have some digestive enzyme, okay, inside your multivitamin, as well as some herbs and other antioxidants. Okay, so then we need to look after our digestion as well. So always remember that you can actually take some probiotics every single day, because when your gut or digestion is healthy, it will help you absorb better, your mood will be better, and you won't feel that much of pain. And then also, in fact, your pain will be lesser and lesser. So happier gut leads to a healthier you. Okay, finally, I guess my key take-home message for you is that any disease, including osteoarthritis, it is not made, but it is caught. So meaning that if you do not look after your diet, or if you don't take care of your lifestyle, including physical activity as per Ben's advice, you may at higher risk of osteoarthritis. Okay, so that's all from me for today.
Yeah, thanks, Miss Cindy, for the fruitful and very clear message about the nutrition.
Yeah.
Yeah. So yeah, Mr. Ben, I'm gonna pass the mic to you from your side.
Sure. Okay. Thanks, Cindy. So just to re-emphasize, magnesium, calcium, vitamin D, that works. Okay, we need them. Okay, in our knee joint. Okay, so now come to physical one. Okay, so when your knee joint space has reduced, okay, as what we saw in X-ray. All right. So how can we help it, and what is the theory behind it? So go back to our X-ray. So normally look at X-ray, we're looking at your shape of your bones, okay, your symmetrical of your bones, your space, and the cleanliness of your bones. Okay, whether your bones are clean or not clean, is there any spurs or is there any wear and tear? All right, and symmetrical is very, very important. All right, then next. Okay, so another knee joint X-ray. Okay, so we are looking at your kneecap position as well. Again, go back to your symmetrical joint space. Okay, next. Okay, then we also will see your knee joint in X-ray in bending position. Okay, same thing. We are looking at how clean your bones are. Okay, symmetrical bones and your joint space. Joint space between your upper bone and lower bone, and joint space between your kneecap and the bone relatively. Yep. Okay. Okay, then yeah. So now this is what we're talking about: arthritic knee joint. So when you come to arthritic knee joint, number one, it's not clean anymore. All right, you see a little bit of patchy white color, and then the symmetrical of the bones also not really there. Okay, some bigger space, some smaller space, and then the joint space also a little bit reduced. All right, like the picture on the right one, the joint space is a lot more reduced, whereby you can't even see the dark color in between of the joints. Yes. Okay, so this is what we call arthritic knee joint, and some people can see a lot of pokey bones. So all this we call it bone spurs, okay, or osteophytes. Okay, next. All right, now, so basically human joint, put it this way, very simple, okay? Consists of three bones, okay? Upper, lower, and the kneecap, all right? And the cartilage in between the two bones. So now what we need to know, we don't need to know everything. All right, next. Okay, so, okay, oh, sorry, so you have to go back.
Okay.
Go back first.
This one?
Okay, so anatomy, yeah. So anatomy, right? Okay, you have to.
Anatomy of human joint.
I want to show the knee bone.
Okay.
Okay, so anatomy of human knee joint. There, this is the one. Upper bone, lower bone, and there's the kneecap in front. Okay, so in between all these bones, there's a space. This blue color is the space. Okay, the spacing. So now normally from X-ray, what we see is space has gone or reduced. All right. Now, medically, what are the options that you have? Injection. All right. And after a few times of injection, if it doesn't work, next is your knee replacement. So now today we don't want to talk about the consequence. We want to talk about how to bring back the joint space. All right. And before we know how to bring back the space, first of all, we need to know what are the theory behind. All right. So okay, go back to the slide. So actually knee joints theory and other joints theory are the same. All right, there are a lot of muscles around the knee joint. Today what you see here, the model on me is just bones. Okay, but there are a lot of muscles around the knee joint. So same thing to our joints of like shoulder joints, our hip joints. Okay, all these joints are surrounded and are whole by a group of muscles or bundle of muscles. All right, so at the end, muscles are the main culprit to explain all the common myths that we mentioned earlier. All right, I repeat, muscles are the main culprit, okay, to create all the problems, pain, disorders around our joints. Okay, so now how does the joint space, the knee joint space reduce? Okay, what is the mechanism? Okay, so let's see what's the mechanism. Okay, so now tight surrounding muscles. Okay, okay, Shui, show me. I am the model now. Okay, close shot. Okay, so I have two bones today here. All right, this is my bone, upper bone, and this is my lower bones. Okay, now within these two bones, there's a joint space. Joint space, this is where my name card is, joint space. All right, now and around these two bones, there's always muscles around them. There's always muscles. So this red color is the muscles. Everyone can see, right? Okay, so this red color is the muscles. Okay, so now if these muscles are loose enough, okay, if these muscles are loose enough, there will be a joint space. That's where my name cards can move about. Okay, imagine when all these muscles are getting tightened, so whereby I double wrap them. So I double wrap them. All right, what happened to my joint space now? Okay, my joint space will be more stiffer. I can't even pull it out now. Okay, compared to just now, my muscles are not that tight yet. All right, just a single tight. So you see, my joint space are so flexible. Can you see the difference? Yeah, so this is how joint space reductions happen. All right, now again, how asymmetrical joint space reduction happen? Very simple. I have muscles on my right hand, I have muscle on my left hand. So now one of my muscles on my left hand is tightened up. Okay, but my muscles on the right is loose. So what happened now? Okay, this side I can move, open the gap. This side I can't move, open the gap. So that's all. This is how the asymmetrical happens. All right. So basically, when two bones come to each other, they will definitely come with a joint space. This is for sure one. Okay, the joint space is for the lubricants there. Okay, to offset to control all the friction, wear and tear, absorption of shock. So now when your muscles surrounding your bones are so stiffened up, you will definitely squeeze and close down your space. Okay, so therefore that explains why age matters. It does not matter. Why age does not matter. Why body weight does not matter. Why exercise does not matter much. Okay, the one that matters is your muscles. All right, so therefore, even though how much of a good best supplements you take, right, if you don't take out all this stiffness, your wear and tear is still ongoing. All right, so that's all, very simple. Okay, so same thing to other parts of the joint. So stay tuned on our every Saturday's live. We will talk about other parts as well as like our shoulder. We will talk about hip joint, ankle joint as well. Okay, one by one we will complete it. All right, so go back to our slides. Okay, so what is the causes to joint space reductions? Of course, number one we are looking at is the surrounding muscles are very, very stiff. All right, number two, wrong gait. Wrong gait means the way you walk, salah. The way you run, salah. The way you sprint, salah. Okay, if you're a golfer, the way you swing, wrong. If you know golfer, how they swing, the right leg will be tilted, the left leg will be weight bearing. Okay, with body weight shift. Okay, if you're a skipper. Okay, so all this we call wrong gait. All right, all this will lead to a joint space reduction. Right now, of course, there are some pathophysiological changes like rheumatoid arthritis, psoriasis arthritis. Now, all this is congenital. Congenital means since young, genetic control, it has been there. All right, so all this will naturally makes your joint space reduction. But of course, there's something else we can do lah. So, but anyway, what we going to tell everyone today is muscles around your knee. Okay, if your muscles around your knee joint is so stiff, for sure, your joint space will reduce faster than normal person. Okay, so that's all. That's a message That's a message. Okay. Now we want to know what are the muscles around our knee joint. All right, which we have talked about it earlier. All right, so today let's just have a quick review. Now, muscles number 1, quadriceps, our front thigh muscles, quadriceps. Okay, muscles number 2, our hamstring muscle.
Yeah.
Okay, our hamstring muscles, the muscles behind our thigh. All right, which run down from our glutes behind our thigh. Muscles number 3,
calf.
okay, our calf muscles. Okay, we have a calf muscles called gastrocnemius. It's a two joints muscle. It also cross over our joints. Okay, so these are the 3 priority or primary calf muscles around the knee joint. If they contract or they shorten or they stiffen up together, they will bring your joints close to each other. Okay, so therefore you need to know how to stretch all these 3 muscles. Okay, so yeah, quads, hams, and calf midf. So you need to know how to stretch these 3 muscles. Okay, we won't spend a lot of time on these 3 muscles because why? Our previous lives, we also talk about all these 3 muscles stretching. All right, quad stretch. So there are a few ways to stretch your quads. Okay, most importantly, don't fall when you do it. If you fall, it's not our responsible. Okay, do it in a safe way. So you can do like the gentleman, okay, or you can do it like the dear lady. Okay, it's all to stretch your front thigh muscle. The most importantly, you feel the stretch at the front thigh. Okay, next. So you also can do it in sideways if you're scared of fall, frightened. Okay, you also can do it sideways, or some people prefer to do it in facing down position, which is lying down on the floor. Also can. Okay, so next. So you also can do it on the bed as well if you want to. All right. So most importantly, you reach your goal. What is your goal? Your goal is to stretch the front thigh muscle. All right. Now next. So that will be about your hamstring muscle. So a simple sharing about hamstring stretch. Okay, just put your leg on a coffee table or any table in front of you, and then just bend forward. All right. Okay. I forgot to mention all these stretchings you need to hold for a while. Okay, at least 10 seconds to 15 to 20 seconds holding. You don't go and then come back. Then that's not stretching. Okay, that's I don't know what you call, but you stretch first. Okay, you bend forward, grab the toes, stay there for 10-20 seconds. All right, that's where you stretch your hamstring. Hamstring is the muscles behind your thigh. Okay, next. Okay, and then next your calf stretch. Okay, there are few ways to stretch your calf. Okay, some people do prefer the one on the left, whereby they anchor the feet on the wall. Or some people prefer the second one, which I prefer the second one. I call it push wall exercise. Or some people prefer the third one on the right, which is we call it downward dog pose. Up to you. All right. Most importantly, you feel stretching at your calf. You feel pulling at your calf. That's all. That's why you try to reach. Okay. So these are the 3 primary muscles around your knee that can close your knee joint space. Okay. So if I don't want to do stretching, can I do something else? You can do foam roller. All right, you can do foam roller, or we call it self-massage. All right, you can learn from this picture, self-massage for about 5-10 minutes, okay, so that you feel a bit of loosening of the thigh muscle. All right, you can even self-massage on your calf muscles. Yes, okay, oh, sorry, this is the hamstring muscle. Oops, and the inner thigh muscle. Okay, and your, and your calf muscle actually. Oh, I missed out one slide. Okay, never mind. So basically, you're trying to touch all these 3 primary muscles: the front thigh, the back thigh, and your calf muscles. All right. So this is from me. So I hope everyone after this live, right, everyone do understand a little bit more about joint space, how the joint space reduction happen. All right. So it happens because of the muscles around your joint stiffen up. All right, so now if you ask me, why my wrist joint space also reduced? Very simple. All your muscles around your wrist joint stiffen up. Why my joint space on my right shoulder got cracking sounds? All right, so same thing. All the muscles around the shoulder is stiffen up. That's why there's a cracking sound. Okay, so why my ankle cracks every time when I walk? Because your muscles around your ankle are stiffen up. That's all. Okay, so that's all from my side. Shuhui, thank you.
Yeah, thank you, Abin, for sharing. Still the culprit of all this grinding sound, joint space reduction is all our muscles tightness.
Yes, muscle tightness. Yep.
Yeah. So now we're gonna a very exciting session is that we are having a quiz now. Okay. Okay. So yeah, mystery gift worth 40 ringgit from Groway to be won. So Miss Cindy, do you want to ask about the quizzes?
Ken, so let's go to the first question,
Okay.
if that's okay. All right. So this is something, just a very basic, general knowledge question. So what are the types of foods and drinks that can increase your risk of joint pain? Okay. So A, high fat, B, high sugar, C, high salt, D, all of the above, E, none of the above. So on your page, please type your answer with Q1 representing question one and your answer. Okay. So the fastest the faster you answer, the higher chance of you winning our special prize. Okay, so give you a
Oh,
few
very fast.
seconds.
There are a few comments.
Oh, okay,
Yeah,
that's good.
but do remember to
Okay,
tag your
so
friends, yeah, friends and family. Tag 3 friends and family, yeah. Yes, Cindy.
yes. So other than answering the question, remember to tag your friends as well, as Shu Hui mentioned just now. So let's move on to
Okay.
question number 2. Okay, so question number 2, what is the best time of the day for Malaysians to get adequate sunshine vitamin? So A is 10 a.m. to 12 noon, B is 7 a.m. to 9 a.m., C is 10 a.m. to 3 p.m., and D is 7 a.m. to 11 a.m., sorry. So in your answer, please type Q2 representing question number 2 and your answer. So again, when you answer, remember that in order to win, you need to tag 3 friends as well. Okay. So when everyone's ready, so let's move on to question number 3. So question number 3, what is the definition of a healthy meal plate for Malaysians? A is suku separuh, B is suku separuh, C separuh suku, and D is separuh suku. So again, in your answer, type Q3 for question number 3 and your answer. And remember to tag 3 friends as well.
This one is a bit tricky, yeah.
Actually, I show it in my slide just now. Actually, so it's a meal plate. So just
Yeah,
that if for those who are not very familiar with Malay, maybe a little bit tricky.
yeah.
Okay. So
Okay.
moving on, we have question number 4. Okay, which mineral is good for helping to relax your muscle? A is magnesium, B manganese, C magnum, okay, and D for magnet. So type your answer with Q4 for question number 4 and your answer, and remember to tag 3 friends. Okay. So next we have is question number 5. So question number 5, what is the role of fish oil supplementation in the prevention and management of osteoarthritis? A is fat control, B weight control, C inflammation control, D all of the above, E none of the above. And again, in your answer, type Q5 for question number 5, your answer, and remember to tag 3 friends. Okay, next we have the very last question. Okay, hopefully one of you will be one of the lucky last winner. Okay, so for the last question, what is the role of dietary health supplements in the prevention and management of osteoarthritis? A, used for treatment purposes. B, used to meet the nutrient gaps in your daily diet. C, all of the above. D, none of the above. So again, in your answer, type Q6 for question 6, your answer, and to tag 3 friends.
So yeah, remember to tag 3 friends and families, yeah. So in
Okay,
the
so I'll pass
meantime,
the floor back
yeah,
to you.
yeah. Thanks, Cindy. Thanks. So yeah, so those who are watching us or our viewers, so yeah, if you have any questions, you can ask in the comment below, and Ben and Miss Cindy will try to share and answer.
Okay. So I think last slide, right? There will be one more slide, Shui.
Oh,
okay.
yeah. This is part of the gift, part of the mystery gift. So those lucky winners, other than the product, we will be giving out your e-shop voucher as well if you want to do some e-shopping, online shopping.
Okay, that's good. And
right.
Is there any slide? Oh, last slide.
This slide.
Yeah.
So yeah, just stay tuned for our next Saturday, 4 p.m.
Yes.
We are going to talk about brain disorder dementia.
We talk about brain, yes. Wait, everyone stay, just quick one. Okay, come, I'll put the thing back to me.
Yeah.
Oh, I should have said it. Okay, so everyone, so that I have one what call it book. Okay, my book has launched. Okay, actually it was before MCO. So now this book is now selling at 100 ringgit. So this book actually is basically talking about entrepreneurship and our history of how BENPHYSIO started and founded. So, and we are selling this book for charity actually. So all the yield will be channeled to a charity purpose. So if you want the book, okay, do comment book, and then we will get the detail from you. Okay, thank you. So this is the book. I think you can get it from, I can't remember already. I think some KLCC bookstore. You also can get it from KLCC bookstore. Okay, thanks. So Cindy, if you want, let me know. All right.
No problem.
Yeah. Okay. So thank you, everyone. Thank you, Cindy. Thank you, Shui.
Thank you, Cindy.
Okay, bye-bye.
Thank you.
So we end.